See, I almost forgot. There we go. Because I know that some people wanted to join but couldn't because we were sold out pretty fast. So that's awesome. But I'll be sending the recording to everybody within about a half an hour, same as usual, just in case you want to look at these things again. And some of you that are here with us this morning, you actually haven't taken the pharmacology yet in the board exam prep course. That comes next week. So this will be a good sort of initial review for you to sort of get you studying a little bit for our pharmacology and oral pathology session next week. So it will be good to learn a lot today. For those of you who are here, have you all been studying a little bit about the pharmacology so far, or have you not started yet and this is going to be your first time sort of looking into it? I'm just curious where everybody is at this point. I see a lot of people saying that they haven't started studying yet. Some say that they have started. So that's good though, because the board exam is in a couple weeks, and pharmacology, there's a lot to know, absolutely. So if you haven't started yet, that's okay, but I would certainly recommend starting today. So this is a good starting off point, because I do like to tell my students a day or 2 days before the board exam, make sure to study only pharmacology, like take a good 4 hours to 6 hours at the most, and just study as much as you can, because they do tend to have pharmacology on the board exam. They could ask anything from simple medications, they could ask about special needs pharmacology type stuff, they could ask almost anything. But a funny story with that, when I took the board exam, they had one question on my board exam, and that was about, it was something about gingival enlargement and the medication that a client could be on that actually causes that. And that's the easiest question ever. So I kind of thought, oh my goodness, I studied so much on pharmacology, and that was the one question they had on my exam. But the other people that took the exam at the same time, because there's usually 3 or 4 different tests and different exams that are going around in the room, they all had a lot of pharmacology. So the test that I just happened to have had one question, that's it. But from what I'm told so far and since then, there's always a lot of questions, so this is something you have to know. So it's 9 o'clock now. I'm going to get started. We have about an hour here today, so I do want to get started. There's a lot to cover. We may not even be able to finish all of the questions here today, but that's okay. I'll be sending everybody who did sign up the full PowerPoint afterwards too. So if we don't get through all the questions, that is okay. I don't think we will, because I did put up a lot here. And the recording should be sent to everybody's email within about a half an hour. So you will all have that. So it looks like everybody's in, which is perfect. So let me get started. But quickly, for those people who have never signed on to a session yet, or have only been to a few, because I do have some new people here, what I like to do is they're mock exam type questions. So I go over a question, I give you guys a moment or two to answer, and if you don't mind typing your answer in the chat bar to the right-hand side of your screen, it could be on the left depending on the type of computer or software or internet you have. But if you could type in your answer so that I know that people have had a chance to read the question, and then I can move on. And if everybody gets the question wrong, then I know to explain it further. But if everybody gets the question right, then I know you don't need me to explain anything further, and then we can move on. So that's just how I like to do things. If you have any questions at any time, though, please just let me know. I do not mind. So let's get the fun started, shall we? So let's go on to the first question. So, and keep in mind, for those of you who haven't studied this yet, this may seem very hard for you, and that's okay, but this is a good way to get started. So question 1, so what are hormones for? Is it A, does it regulate the system? Does it B, regulate body functions? C, maintains homeostasis? Or D, both B and C? So this is a very vague question, but simple as it sounds, what are hormones for? So what do they do? What are they used for? Because they do have some of these very simple questions on the board exam. In fact, this exact question was taken, I mean, not the exact question, because I'm not allowed to do that, but this similar question format was taken from the board exam not the last board exam, but the board exam previous to that one. So this was on the board exam. So I'll give you guys a second to think about that because I want to give everybody a chance to answer. And I'll be talking about it a little bit afterwards too, because just from the answers I'm seeing so far, I'm getting a lot of different answers, but I'm getting a lot of the same one too, so that's good. So a lot of you do know your stuff so far, which is a great sign. But there's a lot of people here today, so I want to give you guys a second. And the answers are coming in very fast, so that's awesome. It means you are all awake nice and early on a Sunday morning. That's perfect. Okay, so the answers have stopped coming in. I got a lot of C's and a lot of D's. So I wonder what the answer is. Okay, so the answer is C and B. Okay, so the correct answer is the last one here. So hormones, which I think I might even have a slide afterwards to explain it a little bit. Okay, so what hormones are is they help to keep the body, I guess, functioning properly. Because if your body's too low or even too high in a certain hormone, that's not a good thing. And then the body's not functioning properly. So the correct answer, once again, was it's supposed to regulate body functions and maintain homeostasis. Does everybody understand what homeostasis means? It just basically means to keep things functioning in a regular pattern, I guess, for lack of a better word. So A is not the right answer because to regulate the system, it doesn't regulate the whole system per se, but specifically the body and the body functions, and it helps to keep things working properly. So that's why D is the most correct, but a lot of you did have that, which is excellent. And I just sort of have a little side photo here for you, for those of you who can see it. If the picture's a little bit small, I'll be sending this to everybody afterwards anyway, but most of you did have that right. So I think we're okay to move on, but stop me if there's any questions, of course. Okay, so next question. I hope you all have this right, because even if you haven't studied, this is something that should have stuck in your head in school, and you should all know this. So, and this was on the last exam, believe it or not. I find this a very simple question, but apparently it was on the board exam last time. So, what is the pituitary gland also called? Is it A, the master organ? Is it B, the master gland? Is it C, the master pituitary? Or D, the master hormone? And I'm actually hearing some echoing a little bit, so just in case anybody has their mic turned on, I'm just going to turn it off from my end here. So just in case you're wondering why I'm turning off your mic, that's why, because sometimes there's too much of an echo. So I'm just turning off those people's mics that do have them on. So that should help you all a little bit. Okay, so I'm getting a lot of answers here, and it looks like you're doing pretty well so far. Some of you do have the wrong answer, but that's okay. I'm assuming it's because you haven't studied yet. But this is fairly simple, so I'm hoping you all will get this right, or most of you anyway. And I find this one simple, so I'm not going to wait too long for you guys to answer that, because we do have a lot of questions to cover, and I want to make sure to get as much as we possibly can. Okay, so far so good. You know what? You guys are doing pretty well so far, but these are simpler questions. We get into the harder ones later. But yes, okay, so the correct answer is B. It is also called the master gland, and I should have a slide. Okay. Somebody's saying that some of the answers are being shown to everybody. So if you could kindly make it so when you're typing your answer, if you could type it to only show me, because actually a few people are saying that it's making them think of a different answer. If they see somebody else's answer, then they think, oh, okay, well, I'll either pick this one or I won't pick that one or whatever, but it seems to be a little bit confusing. So if you don't mind, when you type in your answer, there's a little drop-down menu that says to. Um, have it so you are only sending it to me, okay? And if anybody has any questions about that, just let me know how to do that. But that should help because I've had a few people saying, you know what, when I see the other answers, it's making it hard to concentrate. So if you don't mind doing that, that would be fantastic. But yeah, you guys, okay, so the pituitary gland is also called the master gland, and I have the slide afterwards. So can everybody see this okay, or is the font too small? It looks okay on my screen, but I just want to make sure it's not too small for everybody else. So this is just sort of a quick side note. And somebody's saying it is too small, and I thought so too. So you know what? Let me just take away the title here and make this a little bit bigger. And keep in mind, you will all be having this afterwards too. Like I'll be sending it to everybody's email. So I apologize for the small lettering here. But there, this is as large as I can make it, so I hope this is easier for you all to see. But this is just sort of a little more of an explanation of these types of, I guess, hormones. So the pituitary gland is also called the master gland. That's very important because it does control a lot. When it comes to hormones, this is the gland you want to be talking about. So that's why I put this down here. On the last board exam, so everybody pay attention, they did ask about this hormone here, which I'm going to highlight for you all. I'm highlighting the hormones they asked about on the last exam. Please know these hormones. I'm not saying they'll have them on the next exam. I don't know. They could have some of them, they could have all of them, they could have none, or they could have other hormones. So I'm not saying study these and don't study anything else, but these ones that I've highlighted in red were on the last exam. So please know those. But in my opinion, you should be studying this whole slide because if they ask about hormones, it's probably going to come from this slide here. So just so you know, this may seem very confusing for those who haven't studied yet, so I'm not going to talk about it too much, but if you have questions, let me know. If you're studying tonight and say, okay, I'm getting a little bit confused here, just send me an email and I'm happy to help. So I'll move on from that, but just to help you all out, so I did highlight these. I'm going to save it, and I'll send this to everybody's email afterwards. Okay, you guys, next question. So the luteinizing hormone and follicle stimulating hormones are in the what lobe? Is it A, the posterior, or sorry, A, the anterior, B, the posterior, C, the lateral, or D, the superior? And you know what? This was actually on the slide that I was just showing you all. So I guess for those of you who are paying attention or have a good photographic memory should be able to get this one. But I'll give you guys a second though. And you're all starting pretty fast, or you're all answering pretty fast, so that's a good sign as well. Actually, this might not have been on the last slide. I can't remember if I put this on the last slide or not. I don't know. We'll find out in a second. I don't want to say too much because I don't want to influence your answer, so I'm sorry. I shouldn't even have said that. So we'll see how you guys do. I like these types of questions because if I was a student, honestly, I'd be thinking, oh my gosh, what? But if you studied this, you should know. Okay, so the answers have stopped, so I'd like to talk about this one further too. So yes, so the answer is A, the anterior. And this is just simply a memorizing type of question. I don't know how to explain this further because it's a direct sort of definition, but I want to say C and D are not correct because lateral is not a lobe and superior is not a lobe either. So let me just underline that for you all here. So the question's asking about a lobe. So even if you didn't know the answer, look at the answers that are provided and say, okay, well, what answer couldn't it be? Because that should help you out. So if you're ever stuck, you don't know the answer, think, okay, well, what answers couldn't it be? Well, since it's asking about a lobe, the lateral and the superior are not lobes. So it couldn't be C or D. So then you have the anterior lobe and the posterior lobe left. Even if you had no idea, just pick one. You have now a 50-50 chance, which is pretty good, and then you have a better chance of getting the right answer. So did that help everybody? And here's, oh, I thought I had a slide on that one, darn. But anyways, it was probably from the last slide anyway, so maybe that's why I didn't have an extra slide here. So we're talking about which hormones was it asking about? The luteinizing and the follicle stimulating. So see you guys, we have these hormones right here. So this actually was from the last slide. So the question was asking, where are these two hormones from? Okay, and it says right here, they're from the anterior lobe. If you needed more help with these types of things, I do have a pharmacology mock exam package, which actually explains all of this. But if you're part of the board exam prep course, you actually have that package in the membership login page anyway. But if you're not part of the board exam prep course, you would not have this yet. So if you needed more help with this, I do have a pharmacology mock exam package for you that has pharmacology PowerPoints. I believe there's 2 or 3, and they're hundreds and hundreds of pages, so it's a lot to study from, but it will help you out. So if that helps, but I think most of you are part of the full board exam prep course if I'm not mistaken, so you should have this stuff anyway, but I'll send it to your email afterwards just to be safe, because I know there's a lot of notes and a lot of material on the board exam prep course, so things can get a little bit confusing. So we're still talking about some hormones here. So, and I did this because there was a lot of hormones on the last exam. So just in case you're thinking, why is she asking only about hormones? There was a ton on the last exam. I don't know why, but there was a lot. So next question here, you guys. So where is ADH located? Is it A, the anterior lobe? Is it B, the posterior lobe? Is it C, both the anterior and posterior lobes? Or D, none of the above? So you have to know what ADH is, and you have to remember where it is located to answer this question. And this is kind of tricky too, because all of these are a lobe. So you have the posterior, you have the anterior, or is it none of the above? So with this one, you can't really do process of elimination because you either know the question or you don't. And a few people are asking me, what is ADH? I'll explain that afterwards because on the board exam, this is how they would have the question and they might not actually explain what it is. So you do have to know it, but I will explain that afterwards because I don't want to influence anybody's answer. So if you don't mind just holding off for 1 second, I promise to explain it afterwards. But even if you're not sure, just pick one, just take a guess. Okay, so the answers have stopped. Let me talk about this further. Okay, so the ADH hormone is located in the posterior lobe. And let me just see if I have a slide explaining. Yes, I do. And everybody, I know this is small, so I'm just going to change this and make it larger for you all. So you did have to know what ADH is. Now, ADH is a type of hormone. Sorry, I'm just making this bigger for you guys. So ADH is a type of hormone, and I had explained it a little bit further here. So all of this here is located not in the anterior lobe, but in the posterior lobe. Because if you remember, we talked about the anterior lobe up here, okay? And I wanted to give you guys the exact name for ADH2, but I couldn't remember the spelling, so I kind of looked at that quickly for you. So ADH, just so you guys know, ADH means this hormone here, and I'm going to try to pronounce it, the adrenocorticotropic hormone. Okay, I think I did pretty well with that. So sometimes on the board exam, they do refer to it as ADH, and sometimes they do call it this hormone. So unfortunately, you need to know what they mean, okay? You need to know both of them in case they call it one thing and not the other thing, unfortunately. So all of this is part of the posterior lobe, okay? Because remember, you have the anterior lobe and you have the posterior lobe. So the question was, where is ADH located? So specifically in the posterior lobe. So I recommend knowing this slide here in its entirety because this is talking specifically about the posterior lobe. And this is slide 12. And please know the anterior slide as well because it's talking about the anterior lobe. And that is slide 7. So all of these you need to know. Oh, and I'm sorry, I picked the wrong hormone for this ADH because that's actually ACTH. So what is ADH called? I'm going to look that up with the next question. So that's a different hormone. I thought that sounded kind of weird because I don't think it's called antidiuretic, but I'm going to check that. So hold off. Is it antidiuretic? You know more than me because I thought it was something else. So if that's true, I'll put that down here, but I'm going to look it up because I see that somebody has said that this is what the ADH hormone is, but I could have sworn it was something else. But you know what? I've been teaching for so long that sometimes I even make mistakes too, so that's very, very possible. So I'm going to look that up as you guys are answering the next question because I do have my notes here, so I'm going to quickly look that up. So awesome, very, very smart. You guys are on the ball. I love it. But any questions with this? So I do want you to know what's in the anterior lobe and the posterior lobe. I say that because they had all of this on the last exam. Okay, so I'm going to look that up in a second. But next question, let's move along here. So this question I like. This is always on the exam. Most people don't or wouldn't think it would be, but it is. So what can be used to induce labor? Is it A, oxytocin? Is it B, pitocin? Is it C, stimate? Or D, A, and B? And while you guys are doing that, I'm going to look up what the ADH hormone is, because it's completely escaping me, which is so funny. It must be Sunday, because I got it in my notes here. I know I do. Because all I know is the ADH, well, you know, is part of the hypothalamus. So it is part of that. Oh, good. You guys are right. You guys are smart ones. So just quickly, I want to say that the ADH, yes, this is what it is. And it's from the hypothalamus. Oh God, I hope I spelt that right. So great job, you guys. Fantastic. But anyways, I'm sorry. So what is the answer to this one? And then I have a question for you guys afterwards, but I will ask you guys that in a second. Okay, so I'm getting a couple different answers here, but that is okay. Okay, so you guys are doing pretty well. Fantastic. So A and B are both used to induce labor, and often students don't know this one at all. They see A and say, okay, that looks familiar, so that is going to be my answer. But the truth is, the most correct, it's actually A and B as well. I should have that in my next slide. Darn, I don't. Could have sworn I did. Um, but yeah, I mean, there's not too much else to really explain with that anyway, but you do have to know that both of these drugs, A and B, are used to induce labor. So some of you might be thinking, well, why would somebody do that? Well, if a mother, if her due date was a week ago, it's time to induce labor. If the baby's having complications or the mom is having complications and they need um, the baby to arrive now, this is what they would do. They, of course, prefer not to do that because anytime you inject anything or give something extra to anybody, it's not necessarily a good thing. So you have to look at the pros, you have to look at the cons. But this happens. So you all know these are what is used to induce labor. And I just have a question. I just want to check. And somebody's saying, why do we need to know this? You know what? That is a good question because you won't need to know this in the real world. But for some reason, on the board exam, they love to ask about hormones. So that's why this is here. I know that's not a very professional answer from me, but it's true. I don't even know why you guys have to know this because you're not going to be nurses in a hospital. You're going to be a dental hygienist. These you will never see again. These drugs, it's not something you would use in a dental office. So I'm being serious when I say I don't know why you have to know these, but these have been on the last exam. So that's why I'm teaching these to you. And I think that's why it's a good thing to learn with me because I tell you and I teach you what's been on the board exam before because I don't see why students would study this necessarily because they are thinking the same thing. They're thinking, well, we don't use this in the dental office, so I'm not going to study this. I'm going to skip over this and study something else. But that's why not everybody passes because they don't know what to study. So I'm teaching you and telling you what to study. But that's a good question because I don't know why you have to know this either. Trust me, no idea. But next question, and this is kind of the same thing. You don't need to know this in the dental office, but on the board exam you do. So, uh, dwarfism results in a deficiency. Is it A, hyperpituitarism? Is it hypopituitarism? Is it C, vaccinations? Or D, alcohol while pregnant? So you would clearly have to know what this is. And then you need to know, well, if somebody has this, they were deficient in what? And these are the answers here. I'll let you guys think about that one a little bit. But I must say, you are all doing very, very well so far. I'm very extremely happy about that. And you guys are all very fast, so that's perfect. You're on a roll. And I'll explain more about this afterwards too. So a lot of you are picking either A or B. So you have to think, well, do they have too much of something or too little of something? But I'm happy to see you are all leaning towards the right direction. So that's wonderful. But I'll explain that later on. I'll explain it in a second for everybody, of course. Okay, so the answers are stopping. So the answer is hypo. So for those of you who picked that, awesome, because I'd say it was about half and half. So half of you picked A and half of you picked hypo. And I do have an explanation about that a little bit. And this is a direct sort of definition from your pharmacology textbook, from the Darby, from the Mosby's. So, and it says it right here. So when the pituitary gland, also known as we now know as the master gland, if it's not functioning properly, if they have too little of a certain hormone, then this could happen. And just in case you don't know what this is, it means somebody, how do I say this and make it sound like it makes sense? So somebody is a lot shorter, okay? And the technical term for that is right here. So when that happens, which I'm sure you've all seen, so that happens when the pituitary gland isn't functioning properly. And I do see from somebody a lot of question marks. So does that mean you don't understand why this is the answer, or you didn't understand what this meant, or just let me know. You said they have a deficiency. The question was worded oddly. Well, not really, because this is what it is. They have a deficiency in the hypopituitary, right here. So if they're deficient in something, they don't have enough of it. Technically, they could have too much of it, but 99.9% of the time, if you're deficient in something, it means you don't have enough of it. And from all of these answers here, even if you just said, okay, well, I don't know the answer, but I'm just going to take a guess. If they don't have enough of something, hypo typically means too little or not enough. Hyper, you see right here, means too much of something. So even if you weren't really sure what the answer is, you might have been able to take a guess. But then I'm explaining it further. So when somebody has this condition, for lack of a better word, they have too little of something, and this is what they have, I guess, too little of. So is that a little easier? Okay, good, perfect. So I'm happy that that helped you out there. Does anybody else have any questions about anything? But yeah, and this has been on the board exam before too, which you wouldn't think, because again, I mean, even if you had a patient who has this condition, do you need to know what caused it? In my opinion, no, because you're a dental hygienist. If you were a nurse, yeah, sure. If you were a doctor, sure, but we're not. We need to know almost as much as them, but you know, after the board exam, you will all not have to worry about any of this ever again. So unless you want to go ahead to be a nurse or something, then you will, but otherwise you won't. So, and time sure goes by fast. It's 9:30, so I'm just going to continue on here. So a couple more hormone questions because I want you guys to know these. Okay, so what are the two iodine-containing thyroid hormones? Is it A, thyroxine and iodine? Is it B, thyroxine and hyperthyroidism? Is it C, thyroxine and triiodothyronine? Is it D, thyroidothyronine and T3? Some of those are hard to say. What do you guys think? And this one, by the way, by the way, has been on every single exam. So some of you are sending me a message saying, what the heck? Some of you are saying, this is hard. This was on the last exam, you guys. So if you know this, that's amazing. So I'll give you guys a second. And I believe this is the last hormone question, okay? So I promise it's not all about hormones, but I did that because if you guys study this and know this, you will be that more ahead for the board exam, and that's what you all want, right? Because the board exam is coming up. And somebody's asking me for the board exam boot camp. That has a lot of questions. Some of it's pharmacology, some of it's oral pathology, some of it's ADPI, special needs, some of it's about perio. There's all kinds, and there's lots of questions on there. In fact, there's so many questions that typically we can't talk about all of them. So I talk about as much as I can, and then I will send you guys the PowerPoint for that afterwards too. So you'll be getting literally hundreds of questions, but it's not all on one topic. It's about a lot of topics. So I hope that answers your question. It does? Awesome. And I think you signed up for the board exam boot camp. Yes, you did. Okay, good. Awesome. Okay, you guys, so the answers are stopping. So let's move on to a different type of question, but let's do the answer for this. So what are the two iodine-containing thyroid hormones? The answer is C. And this is from your slide. Thyroid hormone. So I'm sorry, I did that quickly. So the answer is C, the thyroxine and triiodothyronine. I'm sorry if I pronounced that horribly. And just a tip here. Usually when the question and the answer have the same thing in it, that might not be correct, because you see what the question is here. It says, what are the two iodine-containing thyroid hormones? Because a lot of you had picked A. That's the wrong answer, because the question's asking iodine-containing hormones. So if the question's iodine, that doesn't make a lot of sense, because the question is saying, what are the two iodine-containing thyroid hormones? Is iodine a thyroid hormone? No. So that's why A could not be correct. So I hope that that helps, because a lot of you did pick A, but I'm thinking you picked A because you saw iodine in the question. So you're thinking, I have no idea what the answer is. So since I see iodine in the answer, that could be it. And sometimes that works. But in this case, it's asking about iodine-containing thyroid hormones. And you should know that iodine is not a hormone, so then that's why the answer is not correct. But anyways, you guys, so let me make this bigger. So these are the different types here. So, and this is a direct definition. So two iodine-containing hormones are these two right here, and they are called different things. So you have to know that T3 is this hormone here, the triiodothyronine, something like that. And the T4, also known as thyroxine, is also this hormone here. Unfortunately, you have to know all of that, because I don't know what they're going to ask you on the board exam. So I hope that that explained things a little bit further for you guys. Does anybody have questions so far? Nope, I don't see questions, so let's move on here. Okay, you know what? This is another hormone question, but I would like to talk about this one. I'm not going to skip over it because this was on the last exam. But if the next one's a hormone question, I will skip over it. But what is hypothyroidism in a child? You guys must know this, okay? Is it A, myxedemia, or B, simple hypothyroidism? Is it C, cretitis, or D, cretinism? Oh my God, these words are impossible. And it's Sunday morning, you guys. It's pretty early, so I'm sorry if I'm not saying these right at all. But if the next question's a hormone question, I'll skip over it. But I want you guys to know this one for sure. And somebody's asking if the session is being recorded. Yes, it is. You will have it in about a half an hour after 10. So you will all have it sent to your email by 10:30. Not a problem at all. Because I don't think we can go through all of them. What do you guys think? I'll give you guys a moment. Okay, so the answers are stopping. So the answer is D. This you must know, you guys. It's always on the exam. Again, I'm sorry, I don't know why. You don't need to know this, in my opinion, as a dental hygienist, but for the board exam, you do. Do I have an explanation? Yes, I do, right here. So another tip for you guys, okay? I want you guys to know what it's called in children and in adults. So let me highlight this. This will be on the exam, it always is. And if anybody has this wrong on the exam, you will be in big trouble because I'm telling you right now. In fact, I'm putting some stars beside it, okay? So does everybody see that? You need to know that hypothyroidism, so when the thyroid isn't functioning enough, which is very, very common, when the thyroid's not functioning enough, it's called a certain something in children, which is right here, and a certain something for adults. Two different names for adults. I want you guys to know this, okay? So please study this entire slide. It's slide 23. And a brief thing, they love to ask this on the board exam too, you guys. Hypothyroid pregnant women tend to give birth to offspring with large teeth. Again, why do you need to know that? I have no idea. Actually, you know what's funny? I have very large teeth. And my mom, she's been taking something for her hypothyroidism for, I think, since she was 20. So that has something to do with it, because me, my brother, and sister all have very large teeth. So kind of makes sense, right? Anyways, so is everybody okay with that? You need to know this entire slide. I'm telling you right now, if you study this whole slide, you will get probably 2 questions right on the board exam. And that could be the difference between a pass and a fail. So, okay, perfect. Moving on. And I had a few say, ha ha ha, very funny. Sorry, I just couldn't help. I could not help myself. Okay, so I don't want to ask any more thyroid questions because we're running out of time. So let me just move on here. So, what is the importance of glucagon? And for those of you who have taken my full board exam prep course and have taken the pharmacology unit, you better get this right. So A, does it promote fuel mobilization, which means glucose into the blood? Or B, does it promote fuel storage, glucose out of the blood? C, type 1 diabetes only, or D, type 3 diabetes only? What do you guys think? And like I said, for those of you who have taken the full board exam prep course with me and who have taken this, I want you guys to know what this is. You better have this answer right. I'll give you guys a couple moments. A lot of you are getting the right answer though, so that's fantastic. I am so happy about that.
那你又跑上去干什么啦？
Okay, good job, you guys. A lot of you got that right. So the answer is A, okay? A lot of you did pick A, and some of you had picked B. I think those were the most common answers, okay? So the importance of glucagon, so not glucose, but glucagon, is that it promotes fuel mobilization, which means glucose into the blood. And I'm sorry, somebody's saying they're hearing a lot of noises. Let me see if somebody's mic is on. Okay, I turned off a few others' mics. I think they came in a little bit later, so I hope that helps. So I'm sorry about that, and thank you for letting me know. Okay, so what was I saying? I'm sorry. Okay, yes. So the answer is glucose into the blood. That's important because it's not talking about fuel storage, but it's talking about how the fuel is being moved. And when they talk about fuel, they're talking about this word here, glucose, okay? Because without that, you don't have any fuel, so to speak. So when you're a diabetic, this is extremely important because you have to constantly be aware of either high blood sugar, low blood sugar, because that depends on how much glucose is going into the body and how much is leaving. Do I have a slide explaining that afterwards? I don't know. Oh, I do. Perfect. I do want to explain this further for you guys because they love to ask about diabetes on the board exam, okay? So now you guys know. So insulin promotes, so right here, you guys, promotes fuel storage, glucose out of the blood. But when you're looking at glucagon, it promotes fuel mobilization, which means glucose out of the blood. These two things right here you need to know. I know I'm saying that a lot. I probably sound like a broken record, but I'm trying to help you with this. Know this slide very, very well. And also know that type 1 diabetes means insulin dependent. Type 2 is non-insulin dependent. Very important. So does anybody have any questions about that yet? But I think most of you who took my board exam prep course, you got this right. So actually, I think all of you did. So that's perfect. So good. I take that as a good sign. So no questions. I'm going to move on because we have about 15 minutes left. So I want to do as much as I can for you guys. Okay, so this is a good one. When glucose is measured over a few months, what percentage is the goal? So when you're asking a diabetic client what their percentage is, they should know this number. So is it A, 10%? Is it B, 5%? Is it C, 4 to 7%? Or D, 3 to 7%? And a lot of you are fast and you're getting the right answer. So that's perfect. I'm very, very happy to see that. But I want to give you guys a second, so I'll let you guys think about that. You guys are doing pretty well. I'm very happy. This is awesome. I'll just give you guys a moment because I want to see how you're all doing. Okay, so not bad, you guys. So the answer is C. So 4 to 7% is good. So if they have 4%, if they have 5%, 6%, or 7%, that is good. That is what you want them to have. And I have a little explanation here, which I'll make larger again for you. So, and you want to keep an eye on these numbers because if a patient's diabetes is not controlled, so if their numbers all over the place, that's not a good thing and it's not healthy at all. So if they say to you, I don't know what my percentage is, that's not a good sign. It means they don't care. It means they're not paying attention because they should be seeing their doctor typically every 3 months. It depends on the patient, but typically every 3 months. And they will test that and they will give them a number and let them know what their number is. So remember, it should be between 4 to 7%. So if the patient says, I don't really know what my number is, that's not good. It means they're not paying attention. If they know their number, that's a good sign and they should be happy about it. What else did I want to mention about this one? That was pretty much the main thing, but the key point, you guys, on the board exam, so please listen up for a second here. If a patient is a diabetic, but it's under control, so they're eating right, they are exercising properly, they have a good number, they're taking their insulin properly, they are just like you and me. So they don't have to be coming in every 3 months necessarily. They don't have to be brushing more. They don't have to be, doing anything extra. If the patient's diabetes is under control, there are no issues. So they are just like you and me. So a question on the board exam could have something to the effect of, your patient's diabetes is under control. They're able to manage it properly. What do you do? The answer is nothing. They're just like everybody else. They might try to talk about poor wound healing, poor healing. They may have to come in every 3 months for more cleaning. If the question isn't saying anything specific like they have more tartar or more plaque, if it's only saying that the diabetes is under control, you don't do anything extra. If the question is, your patient's diabetes is under control, they have heavy plaque and tartar, what do you do? Well, since they have heavy plaque and tartar, then you need to look at them as you would any other patient who has heavy plaque and tartar. You would have them coming in every 3 months. But if it just said that the diabetes is under control, you don't do anything different. Does that make sense? Because a lot of students think immediately when the patient has diabetes, they are termed a special needs patient and they need to be doing things different. If it's under control, they don't have to be. But I see that everybody says, yep, sounds good. So I'll move on, but stop me if you have any questions. Okay, this one I like. Which second generation drug is used to treat major depression? Is it A, lithium? You know what? These are really hard to pronounce, so I'm just going to let you guys read that, okay? And pick the answer. And yes, I have a question. Do you have to know both names for the board exam? Yes, you do, unfortunately, because sometimes they might call it the chemical name, sometimes they might call it the brand name, so you do need to know both. So I'll give you guys a second though. Not a problem. Just take your time. What do you guys think? So a lot of you are answering pretty fast. I'm getting a couple different answers here, so I will talk about it afterwards. Okay, so not bad, you guys. So the answer is B, Prozac. I have an explanation. Oh, no, I don't. Darn. But okay, so this is a second generation drug, okay? And that is the main, I guess, word in here that you have to know. So this is used to treat major depression. And this is direct from your pharmacology textbook. So if you weren't sure, now you know the answer. Because all of these, not all of them are used for depression. Lithium is more for bipolar, okay? The Wellbutrin could be used for depression, but it's also used to help to stop smoking too. And this is used for a lot of things. So the main answer here and the most correct used to treat major depression is this one right here, Prozac. A lot of you got that right. I'm very happy to hear that. Let's move on to the next drug question here. Okay, this one I like as well, you guys. And I did talk about this a lot in our classes and our board exam prep course because this is a must-know for sure. So which adverse reaction is from prolonged hydrocortisone therapy? Is it A, osteoporosis? Is it B, desquamative gingival lesions? Is it C, abnormal weight loss? Or D, toxic goiter? So what do you guys think? This is a very important one as well. So I'll give you guys a second to answer that. Okay, so I think everybody picked at least one of these, so let's talk about it. So the answer is A, osteoporosis. Now, a lot of things can happen if you're on hydrocortisone therapy for too long, but this is the most common. So their bones become a lot weaker and more fragile. Any gingival type of lesions actually aren't common with this type of therapy. It's pretty much everything on the outside, if that makes sense. So you won't actually see a lot in the mouth, but you'll see a lot on the outside. So the patient could actually gain weight. They could lose weight too. It depends on the patient, actually. I'm sorry. So that's not a good answer. If somebody's on hydrocortisone therapy for a long time, it depends on the patient. I've seen some patients actually lose weight because their immune system is compromised, so they're not healthy. But some patients actually gain weight also. There's something known, I'm going to write that down here because it's on the board exam sometimes, called a buffalo hump. So this is common with people who are on hydrocortisone therapy for too long. Went on hydrocortisone therapy for too long. Does everybody know what this means though? Hydrocortisone therapy. This means that if the patient needs to be on an anti-inflammatory for a long time, so a certain type of opioid for a long time, because this is what hydrocortisone is. It's not a good thing to be on, but if the patient's in a lot of pain, then they have to be on this. But these are some of the side effects. So it does attack the immune system quite a lot. But the best answer here is osteoporosis. You must know this because it probably will be on the board exam. And somebody's asking me, oh no, I'm sorry, and somebody's asking me, sorry, I have a few questions here. Sorry, I just have a few questions. Let me just scroll up to the top. So somebody's asking me, can you change the C to a bracket? Oh yeah, sure. Because that was throwing you off? Okay, sorry about that. That just sort of happened with the PowerPoint document, and I didn't change it just because I figured that was self-explanatory, but I'm sorry for throwing you off. So I hope that that helps, and I'll save that too, so that way I don't forget. Another question was, aren't adverse reactions pertaining to a reaction that happens after taking the medication? It doesn't have to be. This, though, is a type of therapy. So when I'm saying a prolonged hydrocortisone therapy, that means they are on the hydrocortisone drugs for a long period of time. So what therapy means is they could be taking a series of drugs or a series of medications in combination. So hydrocortisone therapy could mean they're taking an anti-inflammatory drug, plus they could be on hydrocortisone injections for their pain. They could be on many different things. So that is where and why it says prolonged hydrocortisone therapy. So anytime you see the word therapy, it means they're doing a combination of things. Like if you think about somebody who's been in a car accident, maybe they hurt their legs and they need to be on therapy to sort what's the word I'm thinking? Physiotherapy to sort of help them walk properly again. So they're taking therapy to help them walk, but they're probably on some painkillers, they're probably on certain drugs to help them too. So just therapy means, I guess, a combination of things. And you could see this on the board exam. So please know, anytime you see adverse reaction to anything, it doesn't necessarily mean one drug, it could be a combination. So that's a good question. So thank you for mentioning that. And another question. Actually, no, I think that was all the questions because the next things that people are saying thank you. That makes sense. But any other questions? Because I don't want to confuse anybody. And somebody's asking, what is hydrocortisone therapy? So like I said, so hydrocortisone, I'll break it up here. So hydrocortisone is an anti-inflammatory drug, typically an opioid. And for those of you who remember what the opioid is, it's a very strong drug, and you're not supposed to be on any type of opioid for a long period of time. You're not supposed to be, but it happens because opioids are very addicting, okay? But if you have to be on an anti-inflammatory drug, you've probably been in a car accident or you have arthritis, you know, something's hurting you a lot. So when you stop taking them, you feel the pain. So who would want that? So hydrocortisone therapy means you are on a series of drugs or therapy to help with that pain, specifically inflammation, because that's what hydrocortisone is. I'm just going to highlight that. Means inflammation. Okay, so that's what that means. I hope that helped. And everyone's saying yes, that did help. And somebody's saying opioids as in NSAIDs. Yes, I will put that down. So if that helps to explain things further. That is a typical comparison too. So yes, it's just opioids are very strong and very addicting. So you don't want somebody to be on that for a long period of time, but it could happen. Wow, you guys, it's 10 o'clock. Honestly, time goes by so fast. So anything we didn't cover, I'm going to send this all to your email anyway. Oh, and that question with the C, let me change that in the question too, just so that's not confusing. There we go. So I'm saving that. Now, before we end things, does anybody have any questions at all? For those of you who haven't taken the pharmacology and the board exam prep session yet, you will be taking that on Thursday. The questions are completely different, so you will be learning more. So I do hope that this did help. Okay, sorry. And somebody's saying we have 3 questions left. Actually, I think we only had 1 question left. Is info. But you know what? I can go over. I think we might have had, because I did skip some hormone questions. But you know what? Let's go over the, whoops, oh no, I just gave you guys the answer. I hope you didn't see that. But anyways, let's go over the last question. Since we have, I mean, it's 10 o'clock, but let's go over the last question at least, and then I'll send you guys the rest of the questions in the email afterwards. So let's go over this last question, and then I do see some other questions, but let's do that afterwards. So the question is, so last question, everybody, which is a protein pump inhibitor used in combination with antibiotics for treating a peptic ulcer? And I'm not going to try to pronounce these for you because I'm going to make them sound horrible. So I'll let you guys read the answer, and then let me know what you think, and then I will answer the other questions here. And then yes, I'll be sending this to everybody afterwards, not a problem. Good, it looks like everybody's okay. You guys are answering, that's awesome. Okay, so you guys are pretty fast, perfect. So the answer is the last one, Prilosec. And again, this is a direct from your pharmacology text and the Darby. Some of you are saying, why do we have to know this? I know, again, it sounds silly, but you guys do have to know this because they love to ask these on the board exam. And I do have some side notes for you too. So A is an antihistamine, just in case you weren't sure. B is an antidiarrheal, and so is C. So the only one here that's used to treat a peptic ulcer is the last one. So that's why that answer is the most correct. So everybody's good there. So I promise to send you guys this right away. I'm going to upload the recording now. It takes about a half an hour to process, but I'm going to send the PowerPoint to everybody's email as well. If for some reason you don't get the email in a half an hour at 10:30, well, let's say 10:35, please let me know because sometimes technical issues happen and I do skip an email address. I'm sorry, but sometimes it does happen. But please just let me know because I don't do it on purpose. We have a lot of students, so sometimes it does happen. So I am sorry. And somebody's asking to send some more practice questions. I can. I mean, we do have them in the board exam prep course too, so you will be getting more. If you wanted some more questions, I do have lots of mock exam packages too. I can get you guys the link for that if you like. I can send those to you guys, but keep in mind though, the board exam prep course, the mock exams that are free in that, you do have a lot of questions, so that is enough to pass. It is enough to pass the board exam, but if you guys wanted more mock exam questions, I have lots. I'll send you guys the link. I'll post the link up now in case, you know, that is something you would like to do. Let me just put that up here for you guys. Mock exam packages, and all of these packages are new questions, so you're all seeing new ones. In fact, I did put up a case studies package also, so if that's something you are interested in, I do have the case studies package too, and that's just all case studies, so it's a lot. And somebody's asking, so if we go through your slides, is that good enough to pass the board exam? In my opinion, yes. Everybody's different, so I can't say you will pass the board exam if you only go through my slides, because that's not something I can promise, you know, as I'm sure you all understand. But from my knowledge, I've been tutoring, sorry, I'm just going to send that link to everybody. I've been tutoring for 10 years, and I tell people, if you only study pharmacology in my slides, there's a lot of slides, you guys, tons of slides, there's hundreds, but if you only studied that and you didn't open the textbook for pharmacology, you will pass the board exam. I don't say that for all the topics, but for pharmacology, it's hard. It's very, very confusing. I actually say don't look in the textbook for pharmacology because it's just going to make you more upset. It's going to make you annoyed. But if you only study my notes for pharmacology, if you study all of these questions, if you study the slides that I am giving to you, you will pass the board exam. But again, I legally can't say you will pass the board exam 100% because I can't say that because I don't know you as a student. I don't know how much you've been studying. I don't know how nervous you get or how anxious you get on the board exam. But of course, from my knowledge, from my experience, you will pass if you only, even if you only study my notes. I've had students in the past who have admitted to me, I didn't open the textbook. All I did was study your notes and they passed the board exam. So that tells me it's possible. But they could have been studying 10 hours a day. I don't know. They could be, you know, they could have a photographic memory. So that would make it easier for them to study the board exam, but they did pass. So if that helps, How long have you all been studying per day? Since we're here, I'm curious, how long have you all been studying per day? I'd like to know. And I see a question here, somebody asking, which books are part of the blueprint to study for the board exam? That's an excellent question. There's a ton of books on there, but they do mention the Mosby's. I was just seeing if I had it on my bookshelf, but I don't. They mention the Mosby's, the Darby, and the Wilkins as the main books. But having that said, from my board exam prep course, I did use all of the books, every single book that they talk about on the blueprint for the board exam. So you don't need to go out and purchase new or additional textbooks, because I took all of those textbooks, because this course has taken me several years to make. So that's why you're all paying for it, because this was not easy for me to make. I literally bought every single textbook, and I do the same thing every single year because it changes about every 2 years or so. They do add on new textbooks and the editions change. So I use all the textbooks in my board exam prep courses, which you're all a part of, I believe. So all of those notes I took from all of those textbooks. But so you know, the main ones, like if you want to know, are the latest edition of the Darby, the latest edition of the Mosby's, and the Wilkins. Those are the main ones to study from. If you're the type of person that likes to study from the textbooks mainly, those are the main ones you have to get, but they're also expensive. So I doubt you want to spend $600 for all of those. Probably not. So you're actually saving money taking my full board exam prep course, because I have all of that info in there. So, but I think all of you are part of it anyway. The books are called, again, I'll put them down here, the Mosby's, the Darby, and the Wilkins. They're expensive books, but if that's something you would like to look into, even if you can buy them used, I'm sure you could, but the latest edition of those ones, those are the main ones. Somebody's asking me, in the Mosby's, it's all the drugs, contraindications, and adverse reactions, etc. How do we know which part to focus on? And that's the tricky thing, because I find in the Mosby's specifically, I find it very confusing and very hard to read. If you were studying for the American board exam, then you need to read the Mosby's front to back. And I do have a prep course for that too. It's a very, very hard course. But if you were to study for the American board exam, then I would say to study the Mosby's for pharmacology, but in my opinion, you don't have to, because it's very hard to narrow things down. So your question is what to focus on. That's hard to say, because it's really hard to say what to focus on, but they like to ask a lot about the anti-inflammatory type of drugs. So if you're listening, write this down. The anti-inflammatory type of drugs, the anti-neoplastic type of drugs, which is for cancer. They love to ask about any heart medications, heart disease medications, heart disease adverse reactions. They love to ask about lithium, so any bipolar medications they like to ask about. They love to ask about antidepressants. Those are the main ones, you guys. So I hope you were listening. They love to ask about those ones. And yes, I will send you that info. And this is also in the recording too that I will have up for you, so you will all have that. But yeah, so everyone's saying that helps. I do apologize, but I have to go because Sundays are very, very busy, and I'm actually teaching another session at 10:30. So I do apologize. I do have to go. Otherwise, I would be happy to help you guys more, because that's what I'm here for. But a lot of you are part of the board exam prep course anyway. I'm teaching a lot of you at a school, so if you have any questions, just ask me then, and then I would be happy to help. So I'll see a lot of you at 10:30. I'll see some of you on Monday, and I'll see a lot of you on Thursday. So thank you all for coming in on a Sunday morning to learn about pharmacology. I hope that was kind of exciting for you. I hope it did help. I hope it sort of helps you determine what to study. So for pharmacology today, if you don't want to, don't look at your textbook. Specifically, look at the pharmacology notes I have for you on the board exam prep course. I know there's hundreds of slides, but I promise you, I can almost promise you, if you study all of that, you'll be fine on the board exam for the pharmacology portion, okay? So I hope they do have a lot of pharmacology on the board exam for you guys. You are so welcome. Thank you all. I will email you all this recording within about a half an hour from now. If you don't get the email, please let me know. I'm going to post the recording also for those of you who are in school. You know who you are. I'm teaching at a school. I'll post it in the discussion forum too, so you also have that. And for the rest of the students who couldn't sign on today, if they would like to listen to this too, that is awesome. And somebody's saying, can I have the info about the 10:30? I don't know your name because it's not showing up your name on here. So if you could just send me a private message, your name. But that is something though that students are paying for, but I will, okay, awesome. I do see your name here, but that is something that the students are paying for. But I will send you the info anyway, just in case you would like to know. But yeah, you guys, so that's it. I don't want to be late for my next session, so I'm sorry that I have to go. But have a good Sunday, okay? And please email me if you need anything. I promise you I'm here to help. Have a good Sunday, and I'll talk to you all next week.